Did you know that 50 million Americans are dealing with chronic pain at any given time? That's more than heart disease, cancer, and diabetes combined. And we're going to talk more about that coming right up.
When I started kind of working in this area, all of a sudden I started becoming aware of just how prevalent chronic pain is in our society. All the advertisements on TV, all the billboards, all the pain management clinics, and I mean, it's just kind of everywhere. And if you just talk to someone for a few minutes, either they themselves or they know somebody that suffers with chronic pain.
Hello everybody, welcome to this episode of RecoveryTV Live. We're going to talk today about how chronic pain affects people and that mental health therapy, so psychotherapy, can actually help with chronic pain. We have a really special guest today. Her name is Erin Bellamy. So she's currently a licensed professional counselor with a specialty in cognitive behavioral therapy for chronic pain. So she'll tell us a little more about that. Without further ado, Erin, welcome.
Thank you. Basically, there's two types of pain, and there's acute pain and then there's chronic pain, and I'll kind of explain what the differences are. Acute pain is an alarm that alerts you to damage in your body. It's something that requires immediate attention. The treatment's usually really straightforward. An example of this would be like you break your arm and you go to the doctor and they put a cast on you and it heals and you go on. And so that's acute pain. Chronic pain, however, it's more persistent, and it typically lasts 3 to 6 months after you've had an injury, and even longer. I mean, some people live for years and years with chronic pain. It can last long after you've been injured, and sometimes it's not even tied back to an injury. Some people, for example, like fibromyalgia pain is considered chronic pain, but you can't trace that back to an injury. It's just pain that just goes on and on and on. So basically the difference is it lasts 3 to 6 months or longer.
Okay.
Historically, the medical and scientific community looked at pain as like a cause and effect. They used to use what was called specificity theory, which means that if an injury is observable, then there's pain. But if you can't observe the injury, then there can't be any pain associated with it. Right. And so basically, the amount of pain you experience should be directly proportional to the amount of your injury. And so they kind of started to realize that that was an inadequate definition of pain. That didn't encompass a lot of other factors that can contribute to somebody's pain. I wanted to just touch on something you said when you mentioned how many people suffer from chronic pain. It really is an epidemic, and a lot of those people are being treated with opioids, and we have 5% of the world's population, but we're using 99% of the world's hydrocodone and 80% of the world's opioids.
Wow, okay.
And so back in 2017, the CDC estimated that 2 million people had opioid use disorder. And so the two are really tied in together. Right. People get addicted to these pain medicines because their doctors have prescribed them. And all of a sudden, before they know it, they're like, I can't live without this medication. And so the two they're really tied together. And it can be particularly dangerous if people are using alcohol while they're using opioids, if they're using benzodiazepines like Xanax. You're 7 times more likely to die if you're using those two together, and 12 times more likely to die if there's sleep apnea present.
Really?
So it can be it's a critical situation for a lot of people. Absolutely, and a lot of people, I am by no means saying get off your opioids right now, but I would advise people, if you are taking opioid medication, you don't want to use alcohol. You want to really talk to your doctor if you're also using Xanax. It just can be very dangerous. So now they've moved to more what's called a biopsychosocial model, and basically what that means is that the scientific community now recognizes that pain has a biological component, a psychological component, and also a social component. And so, there's the biology of pain, which is, the medical etiology of, where did your pain come from and how do we treat it? But then there's also a psychological piece of, how much anxiety does your pain cause for you? How much does it make you feel catastrophic about the future? Do you have fear of movement? Do you have fear of doing certain activities? There's a term called kinesiophobia, which is basically fear of movement. And a lot of people with chronic pain, they fear doing the things they used to do because it hurts. And so that's the psychological piece. And then there's also a social piece. And so how now they're taking into consideration, you know, this is kind of a family problem. Like, how does this affect your family members? This can cause a lot of strain on relationships.
Right.
How does your culture view pain? And so all of those things kind of go together. And the good news for us as mental health providers is that we can work on that psychological piece. Like, that's a piece where we can really go in and make a difference for people in their overall experience of pain.
Right.
The definition of pain, according to the International Association for the Study of Pain, is an unpleasant sensory and emotional experience. That's like the first part of the definition. And so they're taking into account that there is an emotional piece to it. Yeah, and so there was one study that looked at, you know, how do we predict what kind of outcome someone's going to have regarding pain. And they found that even if you take into account what their injuries were and their surgery, the biggest factor that contributed was their level of catastrophizing. And so for the people that are watching that are familiar with cognitive therapy, they'll know the term catastrophizing. It's basically, how much do you predict the future in a negative way? How much do you think, like an example, a pain-related example would be, this will never get better, right? And so you're forecasting what the future looks like in a really negative way. And thinking in those terms really kind of allows pain to just hijack your life and take over. And so that is the biggest predictor of how well somebody's going to do as a therapist, because I can go in and I can help people to manage their catastrophizing and to kind of bring that in and work on some more realistic thinking patterns. Acute pain and chronic pain is all coming from the brain. And so what happens is, when you have chronic pain, your nervous system can get conditioned to just always be firing those pain signals. And so you really have to retrain your brain to not focus on those signals as much. And over time, you can really diminish that nervous system response. So you're literally changing the way your body responds to pain.
There might be a lot of things that I do before I find myself in your office. Is that okay for people, or should the first step be the therapy?
Well, I guess there's kind of two answers to that. I think that people need to do whatever they believe in and whatever they feel comfortable with, because I think there's a lot of power in just you feel really good about the choices that you're making. The other side of that, though, is that the research does show that the earlier you can get in therapeutically and work on some of those thoughts and beliefs, the better the outcomes are going to be. And so ideally, you know, I would love to meet with someone before they go have surgery and talk about what their expectations are. How much are they anxious about the outcomes? What's their catastrophizing like? I would love to get somebody then and then be with them, you know, after surgery through kind of the healing process.
Thank you for being here today and talking about a very important topic. I want to, for those of you that tuned in to Recovery TV Live, I just want to let you guys know that we really appreciate all the support and that we get from the people that watch this, or those of you that watch our YouTube channel. And we do have one final episode for this season, and we're going to talk about is recovery affordable?
Cognitive behavior therapy for chronic pain, also known as CBT-CP, was developed by Dr. Jennifer Murphy at the VA health system, and it's the kind of the treatment that the VA system uses to help veterans with pain. And so she and her colleagues created this workbook, and the beautiful thing about it is that it's 8 to 10 sessions. So it's, you know, you're not committing to years of therapy here. It's really targeted, it's short term, and it's really, really been effective for these people. So the graphic that you're showing, it's a model that shows how negative thinking patterns like catastrophizing can then influence your emotions, which then influence your behaviors. So I'm just going to use kind of an example to help bring this all together. So say that someone has chronic pain and they feel like, well, I can't go to this social event because I don't move as fast as I used to, so I might as well stay home. Well, then they start withdrawing socially, and that leads to feelings of depression and withdrawal. And those feelings of depression and withdrawal then lead to more isolation, more social withdrawing. And so it's this kind of cycle that kind of perpetuates itself. And so if we can get in there and change some of the thinking, maybe change it to, yeah, I don't get around as fast as I used to, but I'm still going to have a lot of joy if I go to this event, and I'm going to go anyway. And then the person gets out and they feel pretty empowered because they did something difficult. We can really start to change kind of the patterns and the behaviors. Right. Well, I've always kind of had an interest in, like you said in the intro, the mind-body connection. And in grad school, one of my professors was a co-author on a book with Dr. Erin Beck about chronic pain. And so I read that book, and I just was fascinated that we could actually, help bring some physical healing through mental health. And a few years back, I had the opportunity to take a position as the clinical director for, it was called the Key Functional Restoration Program. And it was a 20-day-long intensive outpatient program for people who had been injured at work. And so these were people who, had had back injuries, leg injuries, injuries that were debilitating, and they couldn't go back to work. And so the program was structured so that they would come and work with me for half of the day, and then they would work in the gym. We were housed in a gym, and they would go work with a trainer the rest of the day on kind of some of the physical rehabilitation. And it was just an amazing opportunity to see some really resilient people and to watch people really start to heal.